The risk of inflation from an MMT perspective is determined by two things. And we're going to talk about them separately and then put them together and explain why this is so important as a core component of understanding this democracy, US democracy. So two sources of the risk of inflation. Number one, it's the availability of real productive capacity. That is to say, do we have enough doctors and nurses and hospital beds and technology and actual physical productive capacity to serve everyone in this country and provide decent healthcare? If we do, then spending more and being more inclusive in that healthcare system will not actually cause inflation. But if we have a shortage of productive capacity, that is to say, if we actually don't have enough nurses, don't have enough doctors and hospital beds and spare capacity and pharmaceuticals and all of that, then we're going to face a situation where we're going to have a bidding war for those scarce resources. So even if we convince the federal government tonight that, for example, dental care is a human right and every person in this country deserves the right to have free dental care, and we pass this and it's the law of the land. So I pick up the phone tomorrow in the morning and I call my local dentist and I say, I'd like to schedule an appointment. And they say, sure, we're happy to take you. This is now universal access to dental care, and it's a universal human right. And we all agree to this, and the government is going to pay for it. But the next available appointment is in 3 years because we don't have enough people to serve all the population. And then they say, well, if you really need to be seen by next Wednesday, we do have this premium gold membership that costs $10,000 a year. We can see you next Wednesday. So we've just created yet another kind of source of inflation pressure, yes, another socioeconomic exclusion system, because we lack the productive capacity. The good news about productive capacity is that it's producible. We can train more doctors, we can train more nurses, we can train more technicians, we can build more hospitals and hospital beds and so on. And the good news about this is that these producible resources, number one, will allow us to create even more jobs in the industry, make the services more inclusive and fair for everyone, but most importantly, will actually tame and eliminate the source of inflation, which is shortage of capacity. So that's one side of the inflation equation, so to speak. The other source of inflation, which most of you are familiar with and will really connect with here, which is a very important thing, which is abusive market power. When you have key players in an industry, whether it's healthcare or energy and transportation or real estate, when you have key players who can raise prices simply because they can, when you have pharmaceuticals who can raise prices because they can or because we let them. Who lets them? Because the 535 people we elect in Washington, D.C. to regulate market power, they're not doing their job, or they don't want to do their job because their seats are guaranteed by super PACs from those industries. So that type of inflation, abusive market power, can't be eliminated by spending less or spending more on healthcare. It can only be eliminated by taxing and regulating that abusive market power out of existence, by democratizing that market, by using antitrust laws, updating antitrust laws to clean the system of abusive market power. And that can't be done without having 535 people who actually are representatives of the people, a government of the people, by the people, for the people, not a government of the super PACs for the super PACs. So it becomes fundamentally this question of inflation, this question of abusive market power, is a question of democracy, it's a question about corruption. And now we have to put the two together. The source of inflation coming from lack of productive capacity and the source of inflation coming from abusive market power. Those are the real obstacles to having Medicare for all.